Hi, my name is Venuja. I'm doing this video to share how I survived from chemotherapy side effects. I'm 2 years in remission from Hodgkin lymphoma. So these are the tips that I use to overcome side effects from a BEACOPP escalated chemotherapy, which is a very intense chemotherapy regime, which is given to advanced Hodgkin lymphoma and liver cancer. So it's, different people experience different level of side effects from chemotherapy. Some people do not go through very intense strong chemotherapy, and but some people however has to go through very hard chemotherapies that will knock you down, and BEACOPP escalated it's something like that. So if you're going through chemotherapy, you wouldn't have to do everything that I'm telling right now, but if you're going through something really strong that knocks you down, this video will help you. So I'll start with the first side effect. So the main side effect of chemotherapy is having gastritis and issues like constipation, and that gives you hemorrhoids. So once you start chemotherapy, your oncologist will give you something to prevent gastritis and ulcers. Like, this is not exactly what my hematologist gave me, but something to prevent gastritis like Nexium, take every day. And however, when you go through the cycle, you will feel that you get pretty constipated. And that time, what I used is I drink a Movicol with meal, like for all 3 meals, breakfast, lunch, and dinner, to lose the bowels. And if that doesn't work, then I took 3 of these Coxil. But remember, if you take Coxil Senna, that's going to be really hard because that's going to give you a tummy ache and everything. But the orange color Coxil is better than Coxil Senna in the scenario of getting constipated during chemotherapy. But then even if that doesn't help and you're very constipated, you can also use Microlax enema. But remember, don't use Microlax or any enema if your blood counts are pretty low. It's not advised to use enema when your blood counts are low. So keep that in mind. But it's better to just get rid of that before you become seriously constipated. And the next thing is, if you get hemorrhoids, that you will, if you're going through a strong chemotherapy regime, then there are hemorrhoid ointments. There are heaps of hemorrhoid ointments that will numb the pain and numb the area. The next thing is mouth ulcers. You'll probably get mouth ulcers from chemotherapy. So you can use, if you get ulcers, you can use Bonjela, which is over the counter, and also any oral 7. These are the ones that I use. I'm not promoting any brands, but this came free, like in sample packs for me. That's why I keep on using this, because I found this is healing. So someone else might have good experience with another brand. So please share what your experience is and which works for you. And also use non-alcoholic mouthwash every day. So I used all oral 7 products to keep mouth clear. And one other trick that worked for me is my mom prepared this, barley grain. So she soaked barley overnight, and then she brew it with water, and then drain that water, and then let it cool and let me drink that. But it's not very nice. It's like, you feel like, but still, once you drink that, it cures me. Like, it was like a magic potion to heal my mouth ulcers and to keep my mouth really good. So remember, before you start chemotherapy, it is advised to go to a dentist and go through a dental checkup, and if you have any cavities, feel that, because once you start chemotherapy you can't do that because your blood counts are going to drop, and then you can't go through, like even a little needle can bleed you, so you cannot go through dental procedures once you're having chemotherapy. um, and the other thing is that we are well aware of is chemotherapy is going to make you very nauseous. So I had heap of, where's the Onten, so I don't have it with me now. You know, the little wafer you keep under your tongue. That's the, like, the best medicine that worked for me. But apart from that, my hematologist gave me heap of other medicines. This is Onten salt. So this is a prescription one, so you can keep that under your tongue, and it will dissolve and give you a relief from the nauseousness. But the more you take it, it'll give you constipation as well. So it's a balance between those two. And then this medicine as well. So what works for me is Onten salt. I prefer Onten salt, but for someone else it could be something else. And the other thing is going through pain. So when you have a blood cancer, I can't remember, there's an injection that they give to produce blood in your bone marrows. And that injection is so painful, you feel like someone is making a sausage out of you by like twisting your bones. So you need strong painkillers at that moment. So one of the painkillers that I really like is Targent, which is an opioid. But again, it's prescribed, and they say like if you take it more than 2 weeks or so, you'll get addicted to that. But I didn't get addicted. And also at the same time, it can give you constipation as well. So another one is Tramadol, which is also a really nice painkiller. Apart from Panadol and everything, it doesn't work actually. It's not strong enough. So in my case, when I had BEACOPP escalated for Hodgkin lymphoma, the doctor gave me 2 medicines like that I took frequently during the period that I got treatment for. One thing is Balsivara, comes in a tablet like this. This is for chickenpox, to prevent you from getting chickenpox, because I haven't had chickenpox before, so I don't know if it is something that everybody gets, but I never have had it. So when they check blood before you start treatment, I don't have immunity for that. So I haven't get the injection as well. So that might be the case that I was getting that throughout the period. And the other one is Resprime Forte. So this comes in a huge tablet like this, which is not very easy to swallow with all the nausea and everything, but that is for urine infections, because you can easily get UTIs during chemotherapy. You're probably very dehydrated and everything. So it's important that you take, if that by your oncologist have to give you this, that will prevent you from getting urine infections during your treatments. So and one other thing is like for my chemotherapy regime, I had to take high dose of prednisolone every day. So that's going to spike up blood sugar levels. So I was asked not to take metformin because that's going to damage liver, and for Hodgkin lymphoma, the liver get pretty swollen. So during chemotherapy, I took insulin. You know how take a needle and to your tummy. And it's really important to measure blood sugar levels, but this is not what I use actually. I didn't do finger pricking because I had enough pain going through. I didn't want to prick my finger. So instead I use the patch, which I don't have with me to show to you, the Freestyle Libre patch, which is very good because it measures your blood sugar level 24 hours throughout the day, and it's valid for 2 weeks. But it's expensive. In Australian dollars, it's like more than $100 for 2 weeks. But again, it shows the patterns, and if your sugar levels are going to fluctuate during midnight or anything, so your endocrinologists can make good decisions about your insulin levels, and especially if you're going through a hypo, that'll detect it. So it's really important to have a patch if you can afford it. And the next thing is when you go through chemotherapy and your skin become so dry, and it's good that if you use moisturizers, but I didn't prefer it because I think it's like uncomfortable for me. But it's good if you can use moisturizers and moisture your skin well. And the other thing is, since it's not only the outside tissues that's going to be really, really dry, but the inside tissues as well. So it is better if you skip toilet papers because it's going to give you tissue paper cuts. So instead, the hospital gave me a wipe. It's not this baby wipes, but there are like adult, like better wipes that are like moistened tissue, like wipe papers in it, and use them during my chemotherapy to avoid tissue cuts because it's going to be really painful, plus hemorrhoids and everything combined together. And the other thing is really important, each day when you're going through chemo, you have to measure your temperature. You can measure it like from here or through your ear or underarm. So each temperature measurements are different. If you go through, like when you should go to ED, just Google that. If you have the temperature through your ear, let's say 38, but the underarm temperature will be a little bit below, I think. So so it's better you mention to the ED nurse that this is where I get my measurement from. So each day take your temperature measurement, and if it is high, if you're catching a fever, just go to ED straight away because you could be sepsis, which happened to me like in every chemo cycle. Your blood counts will drop, especially your neutrophils, which will make you less immune and neutropenic, that's the word I think. So so it's important that you go to the hospital, and remember, if you get a fever, it's not going to remain, it's going to come and go. So if you catch a fever and by the time you get dressed to go to the hospital it drops, it doesn't matter, you go and tell that I had a fever at this time, and they will go through your blood test and admit you if you're going through a sepsis. So your blood counts are low, and if you need a blood transfusion or anything. And blood transfusions really help you to recover. I've been through blood transfers like at the end of each chemo cycle, which was really helpful, and I'm so grateful for the people who donated blood, red cells and plasma blood donors. And the other thing is you need to measure your pressure. So I had this pressure monitor at my home, which was my parents. So that was very useful because my pressure went low every time, pretty low. So it's not good if your pressure drops down. So if either your temperature, if you're feeling unwell, check your temperature, check your pressure, because it can come because of dehydration as well. So drink plenty of water. It's like you cannot drink much water when you're going through chemotherapy. So one of the tricks I did was like I took a bite of a strawberry or cherry, then I drank few water to flush that off. So if you nibble something and then drink water to flush that content, so that's one way of taking water. Another way is like apple juice is good at the start, but then you get you wouldn't like apple juice much because you've had a lot of that. So dilute apple juice and drink it, and try different juices that you can dilute and drink with, but I don't have a sample to show you. I drank Ensure drink, which was really helpful because it comes with a lot of nutrients, and it's not the Ensure powder. If you ask the pharmacist, he or she will write you a prescription to take Ensure little drink packs, which are like up and go packs, and then if you have it, it'll be like hydration plus a meal. It'll help you to have that nutrition level, have that electrolyte level in you. And it's quite cheaper if the pharmacist give you a prescription for that, and then you have to order it online. It will come to through your hospital or to your home itself, like a lot of packs, and it's really helpful. And what else did I miss? So, and also I had this one. It was not like you can measure your saturation levels and heart rate and everything. I didn't have issue with that, but if you can have one, it's better to check at home. And the hospital give you this every time they take blood, so I keep one with me so I can take this to the hospital to avoid, discarding. They will discard after one patient to one patient. So reusing resources. And then also the pressure cup, the chemotherapy unit asks you to bring your own pressure cup every day, so they don't have to throw this out. It's reusing. I think I pretty much covered everything. So I know it's really tough going through chemotherapy, but if you hang in there, and then after a few years, your hair will grow back and everything will gradually go back to normal. The life wouldn't be the same, but you will get there. So it's worth enduring the pain, going through that, managing your pain. And if any of your loved one is going through a hard chemotherapy regime, I think now you should know what you should be giving them as a gift, or how you should take care of them. So I think this helps. So I should mention that I'm not a medical profession. I'm just talking out of my own experience being a patient. So if I have make any mistakes, just comment down there and correct it. And also share if anything, if you have been to chemotherapy and if anything really helps you. I think either you make a video or just comment below. Thank you very much for listening, and if you're fighting at this moment, I wish you a speedy recovery, and remember that you are a warrior and you will get there, you will survive, and you will have happy days in the future, and it's all worth it. So hang in there. Thank you.